and welcome to the first lecture in Imagining Health in Social and Cultural Contexts. Today we are looking at Sociology and Health. Now, the first two lectures in this unit provide the toolkit or the theoretical concepts that we use to then apply in the rest of the unit. Before I begin, though, you might want to customize your screen and get used to the way we deliver iLectures. You should have visible both the slides, so I've got a gray cover slide here at the moment, and a picture of me talking. What you can do is you can minimize the picture of me into a thumbnail or a tiny photo in the corner there, or have it half and half. Make sure that you can see the slides because that's where the important information is. The reason why I've included the video of me talking is because the literature says that even a small thumbnail of a person speaking to you on screen makes students feel more engaged. If that's not the case for you, you can get rid of it entirely. The main thing you need to focus on is the slides. So let's begin. Were you surprised when you saw this unit in your timetable? Why do we have Imagining Health in Social and Cultural Contexts? Let's look a little bit at this title. So, imagining. We need our imagination in order to see things differently than we do now. It enables us to see possibilities, look to the future. Could we arrange things in a different way? Could we do things differently? What's going on here and how else might it be done? That takes imagination. Now, health may seem quite straightforward to you. It is the focus indeed of all of the disciplines within the health faculty at Curtin University. But what you'll see in this unit is that health is understood differently by different people. And the reason for that is because of cultural and social contexts. So health does not take place in a vacuum. It is not like in outer space with no reference to any other aspect. Of course, health is part of our lived experience, and we live in social and cultural contexts. Our cultural background strongly informs how we understand the workings of the human body. What is health? What is wellness? What is illness? Where should we go when we're not feeling good? All of these are informed by our social world and our cultural world. So therefore, in this unit, we're looking at health in context, the specific arrangements in different locations that impact people's health and wellness. So here are three definitions of health, just to expand on that idea. Yes, what is health? It depends very much upon who you ask. If you go to a dictionary, I've got here a definition from dictionaryreference.com, and I strongly encourage you, when you're looking to define key terms in this unit, do not refer to sources like that. Instead, refer to academic sources. So according to the dictionary, health is the general condition of body or mind with reference to soundness and vigor. I'm not quite sure what soundness is said to be in terms of the body or mind, or necessarily vigor. Definition 2 doesn't go a lot further. Soundness of body or mind, freedom from disease or ailment. So to be healthy means not to be diseased. It's quite a limiting definition here. In contrast, the World Health Organization's definition from 1946 says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So it's directly responding to the earlier dictionary-type definition of health, and it's moving beyond body and mind. It's also bringing in the social component as well. And then a third definition we have here is for Aboriginal health, and this is an Aboriginal Australian definition of health. It says here, Aboriginal health means not just the physical well-being of an individual, but refers to the social, emotional, and cultural well-being of the whole community, in which each individual is able to achieve their full potential as a human being, thereby bringing about the total well-being of their community. It is a whole of life view and includes the cyclical concept of life, death, life. This is much broader than a definition of physical problems within one individual body. For Aboriginal people in Australia, health only makes sense in a communal context with reference to other people. So we're talking about health of the individual and community, and it's not just physical, but social, emotional, cultural, and a part of that is spiritual well-being. So this should give you a quick snapshot of the idea that health is a contested term. Different people understand health differently. And in order then to understand health, we need to look at it in context. The learning outcomes for this unit outline what you need to be able to do. So by the end of this unit, you should be able to demonstrate an understanding of health and illness using anthropological and sociological frameworks. And the first two lectures provide you with that framework. Then we are going to analyze social and cultural influences upon the health of marginalized populations, describe and apply the concepts of cultural security, cultural safety, and cultural competence in healthcare contexts, critically analyze the relationship between health and human rights in national and global contexts, and critically evaluate responses to contemporary global crises using humanitarian healthcare delivery approaches. So these 5 things are what we're going to be looking at throughout this unit. Why are we drawing from the social sciences? This is a health unit. What do the social sciences bring to our understanding of health? Well, drawing from anthropology and sociology, we begin to look at beyond the individual, but society as a whole, and the behavior that leads to health or illness. Taking this approach shifts the emphasis from individuals, sick individuals, to wider social issues, the patterning of disease and wellness, if you like, across society. It enables you as a healthcare worker to critically evaluate the differing ways that the social world may shape the experience of health and illness, to understand the broader social forces that affect individuals, and to consider how healthcare arrangements impact upon the individual's experience of health and illness. So here we have the Imagining Health Toolkit, and this is a list of 10 very important concepts. I would challenge you throughout the unit to apply each of these concepts to the topics that we look at each week. They also influence the essay that you need to write, the content of the final exam, and your presentation on NGOs. This basically provides the framework for learning outcome 1, which was demonstrate an understanding of health and illness using anthropological and sociological frameworks. In the first 2 lectures, I'm going to be going through these 10 points so that you get to know them a bit and understand how they relate to health and wellness. So let's look at the first one, interprofessional education. As you probably know, you are part of an interprofessional first year in the Faculty of Health Sciences. And this is a relatively new structure that we have in the faculty, and it is responding to contemporary health challenges. Today, health problems are complicated. They are global, they are several simultaneous, they are happening in different places at the same time, and they are rapidly changing. The Australian government, for example, will be dealing with 4 or 5 major health issues at any particular time. Societies today are often multicultural and multi-ethnic. Therefore, you have great diversity within societies in terms of understandings of health and wellness, in terms of the illnesses that people develop. And healthcare today is pluralistic, meaning there is not one system or way of understanding health, but several different systems that would be coexisting in any particular place. The result is a very complicated picture. Health is no longer, if it ever was, a simplistic or straightforward enterprise. Therefore, we need health professionals who can work together to understand how their disciplines complement, be proactive, be able to see both the individual and the bigger picture, or wider society or global society, and to think creatively about solutions. And one thing I want to emphasize here is the role of critical thinking. If you look in your, I've got here the Code of Conduct for Registered Health Practitioners. I've got one for the Physiotherapy Board of Australia, another one here for the Pharmacy Board. Each discipline within health within Australia will have a code of conduct like this. And what is emphasized in them is critical thinking. So, for example, from the Australian Nursing and Midwifery Council, National Competency Standards for the Registered Nurse, one of the 4 domains of competency standards refers to critical thinking and analysis. It says, this relates to self-appraisal, professional development, and the value of evidence and research for practice. Reflecting on practice, feelings, and beliefs, and the consequences of these for individuals and groups is an important professional benchmark. And very similar statements can be found in the other professional guidelines. So therefore, being aware of where you come from, being aware of how social and cultural contexts influence health, being aware of the complexity of both the health challenges and the health systems developed to meet those challenges, this is what is required. And this unit very much helps you develop those skills. To be aware, I'll come back to that in just a moment. Let's look at number 2, the Millennium Development Goals. Now today we have a global approach to health, and the Millennium Development Goals is an international health agenda that we are trying to achieve by 2015. This agenda was set in the year 2000, which is why it's called the Millennium Development Goals. And there are 8 different goals, and you can see here the different goals that are listed. So they have to do with extreme poverty and hunger, maternal health, HIV/AIDS, and malaria and other infectious diseases, child health, and so on. Each one of these goals has some impact on health. Now, Australia has committed to the Millennium Development Goals, and it is trying to achieve significant change in each of those 8 areas by 2015. There's a great YouTube link if you want to follow there and have a look at a short video about Millennium Development Goals. For copyright reasons, I can't incorporate the YouTube links or other internet resources into this iLecture, so I encourage you now to pause this iLecture, have a look at that video, and come back to the lecture after that. Now, the reason why we focus on the social and cultural context and on the Millennium Development Goals is because people's health outcomes are strongly affected by their level of power. So various patients and healthcare providers have different levels of access and control over their understanding of what causes health and illness, what the system is like, their access to information and knowledge, again, about their own bodies, about disease, or about the healthcare system, services that are available to them, the ability to make decisions about their own health and what they're going to do about it, the options once illness is detected, or in terms of making good decisions for preventive health, how many options do people have, and what resources are available to people with regards to health and illness. Now, what's very interesting is that Michel Foucault, a French philosopher, has worked on discourse. Now, discourse is a way that we talk about, speak, think, and act about an issue. Now, what Foucault noticed is that there's great power in defining what is normal and what is abnormal in any particular context. He was looking at asylums and mental health at the time, but also the healthcare system, deviance, prisons, a number of different social areas. But when it comes to health, what is very interesting is who has the ability to define what is normal and therefore what is abnormal? Who decides how we talk about, understand, and frame healthcare issues? Why are some health issues prioritized over others, for example? Who is excluded from the discourse of health? And behind this discourse, of course, is the notion of power. People who have more power control the discourse or the way that we talk and think about any particular issue. People who have less power are created by that discourse to have less information, less access, less of an impact on how we understand any healthcare system. So numbers 3 and 4 in the Imagining Health Toolkit focus on the social and biomedical models of health. Now, in many of your units, particularly your discipline-specific units, so on physiotherapy or nursing, etc., you will be focusing on the biomedical model. This is what many people are familiar with. It is the cornerstone of Western medicine. And this table here is from Guermont, the first reading for this unit, outlines very clearly what the biomedical model's focus is, the assumptions, the key indicators of health, etc. This unit draws particularly from what we call the social model of health. And It differs quite significantly from the biomedical model of health, indeed, in terms of its focus, its assumptions, the key indicators, etc. Now, a key concept to understand is that these are not competing models, but complementary. We need the biomedical model and we need the social model, and both of them give us good insight on different aspects of healthcare. So the biomedical model explains illness as a malfunction of one of the body's biological systems. It is very much based on an idea of the body as a machine, or like a car, and one part breaks down and you can fix that part and get the machine running again. It focuses very much on treating individual bodies through particularly drug therapy or surgery. Those are the main two interventions in the biomedical model. We're familiar with the model in the form of hospitals, the university system for training health professionals, the clinics, the whole pharmacy industry that's related to biomedicine. That is all aspects, the structural aspects of the biomedical model. However, biomedicine has been criticized, and in this unit we'll be looking at some of the criticisms of biomedicine. One criticism, for example, is it underestimates the complexity of health and illness. You can imagine if you're looking only at an individual, you miss a range of factors that are impacting the health of that individual and of society as a whole. Biomedicine also has the potential to blame individuals for their health or illness, what has been called victim blaming. If you don't look at the wider context, but only look at the behavior of individuals, you could hold that individual responsible for things outside of their control. There's a very funny take on the biomedical model if you'd like to go to this YouTube link that I've attached at the bottom of the slide. The social model of health, in contrast, seeks explanations for health and illness in people's social and cultural worlds and in the physical environment in which they live. So we're moving beyond the physical body of an individual to look at social, cultural, and environmental factors. It assumes that health is a social as well as individual responsibility and focuses on the social determinants of health status. And I'll show you in a moment what I mean by the social determinants. Now, the social model of health also has its criticisms. Some people say it is utopian, meaning it is trying to create the perfect society, the ideal society. People say we can never fix all of the social determinants to make sure that everybody has the same access to good health. Some people say also that it underestimates individual responsibility. We could blame a whole bunch of social and cultural factors when we also have responsibility for our own choices, the food we eat, whether or not we exercise, whether we engage in risk behaviors. So both models have their strengths, both models have their limitations, but both of them are important to get a full understanding of health. So number 5 on the sociological imagination toolkit is the social determinants of health. What are they? Well, here is a great definition from the World Health Organization's Commission on the Social Determinants of Health. It says here that the social determinants of health are the conditions in which people are born, grow, live, work, and age, including the health system. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels, which are themselves influenced by policy choices. The social determinants of health are mostly responsible for health inequalities, or the unfair and avoidable differences in health status seen within and between countries. Now, this is quite an interesting definition of social determinants, and there are a few things I want to draw your attention to. One is it is a very inclusive definition. The conditions in which we're born, grow, live, work, and age. That is an all of life, all aspects of life definition. It also draws your attention to power, distribution of money, power, and resources. These strongly affect our access to health. It's not just a case of genes and germs, but a number of factors that are controllable by policy. That's the third point I want to make. In this definition, it very clearly says that governments have a level of control over the social determinants of health. And therefore, governments are responsible for the fact that we have unfair and avoidable differences in health status within countries and globally between countries. That is the perspective of the World Health Organization. So some examples of social determinants of health. Well, housing. Housing can be a very positive influence on health, nice place to relax, a place to sleep, a place you spend quality time with family. Or housing can be a cause of illness through toxic building materials, through overcrowding, through things like sticky botrytis. When you have a very damp condition in the house, this is a very toxic bacteria that can grow in damp conditions. Another one would be transport. Do you have access, particularly emergency services, to the health system in the case of an emergency? The way gender is organized, that is the socially prescribed roles for men and women, this has an impact on what illnesses you develop, when, how early, etc. Another one would be the early years of life. We now know that the 0 to 5 is key for brain development. If during that time a child doesn't have adequate nutrition or isn't touched and loved, particularly the physical contact and nurturing with caregivers, if that doesn't occur in the first 5 years of life, there are implications for the rest of that child's life. The brain simply does not develop and flourish in the same way. So these are social determinants. They are not genes, they're not germs, but ways that we organize our society that have an impact on our health and wellness. And this is what we are drawing on largely in this unit. Number 6 is the sociological imagination template. Now, the title for this unit and this template, which is a tool we're using throughout the unit, comes from famous American sociologist named C. Wright Mills. Now, he defined the sociological imagination as the vivid awareness of the relationship between private experience and the wider world. So, according to C. Wright Mills, he was differentiating between our everyday, if you like, common sense understanding of the world. We all have views about how the world works, and a much broader analytical sociological view. And he was linking personal troubles with public issues. So, for example, if someone gets made redundant, they lose their job in your family, it is a personal trouble for them. It causes strain within the family. There may be difficulty in paying bills or paying rent, and that is something that affects, it's a personal problem. However, when you take a step back, if you see that because of the global financial crisis or other factors, thousands of people have lost their jobs, you can see this as a public issue or a wider social issue and see it in context. For an individual, it can be quite liberating and reassuring in some ways to take a step back from your personal trouble and look at it in broader social context. So C. Wright Mills said that the sociological imagination is a way of thinking which places individuals and their problems in socio-historic context. Again, like the title for this unit, understanding issues within context. So here's another example of it. Personal trouble. A person is diagnosed with diabetes, resulting in stress and change in the home environment. Interestingly, what's happening in Australia now is that diabetes is supposed to be reaching epidemic proportions, particularly among children, but also in adults. What is going on there? What do we need to look at when it is becoming such an extensive social problem? Our food systems, our advertising, our organization of urban space? When you bounce between the personal and the public, it raises different health issues, different priorities, different levels of intervention. So for a personal trouble, someone with diabetes, we need a good clinic and good advice and access to insulin and programs to educate that person in managing their disease, perhaps access to a nutritionist. When you look at it as a public issue, as I said, you begin to look at structural issues. What role should the government play in changing what is happening? What's going on with different industries within Australia that are all promoting this growth in diabetes? So according to C. Wright Mills, neither the life of an individual nor the history of society can be understood without understanding both. People need not just information or facts, but, and here's the key to this unit, but also reason and a quality of mind. And that quality of mind is what C. Wright Mills called the sociological imagination. So According to Mills, people need to be able to shift from one perspective to another, from the political, the psychological, from family to the global. And this sociological imagination is what we are focusing on and trying to develop in a range of health professionals in this unit. So a sociological imagination helps us to understand the world around us, particularly in the context of globalization when the world is changing so rapidly. Now, Willis created the template that we are using in this unit. He suggested that the sociological imagination consisted of 4 interrelated parts. The first, historical factors. How has the past influenced the present? Cultural factors. How culture impacts lives. Structural factors, this is to do with how we organize society. And critical factors refers to critical thinking. How can we improve upon historical, cultural, structural, and critical factors? Now, what is interesting about health is that we act for a reason. People make decisions in this context, either consciously or unconsciously. One thing that we have to bring into the analysis is people's values, attitudes, and beliefs. We make decisions every day that affect our health based on our values, attitudes, and beliefs. So values generally refer to guiding principles for behavior, and there are some examples there of values. For example, do you value equality between men and women? Again, values do not occur in a vacuum, but are shaped by family background, education, religious beliefs, the political system, environmental factors, a whole range of social factors. And this is important to explore because this will affect both health, illness, and healthcare seeking behavior. Attitudes arise out of our experience and our access to information, and belief systems, religious or otherwise, are guiding principles that help us make sense of the world. All of these come together to affect our health behavior. They also inform the structure of our healthcare system. Now, number 7 on the sociological toolkit is the structure-agency debate. Now, this is quite a famous and ongoing debate within the social sciences, and it is about the extent to which human behavior is controlled by social structure. So let's explore. On the one hand, we have agency, which is defined as the ability of people, individually and collectively, to influence their own lives and the society in which they live. On the other hand is social structure, the recurring patterns of social interaction through which people are related to each other, such as social institutions and social groups. Now again, when you think about social structure, think of a structure, which is another way of saying like a building. Social structure are ways that we organize society that stay more or less the same over time. Now they do always change, but there is some continuity because structures are fairly firm and solid. Agency is the ability of people to act, to make decisions, to change their lives, either individually or as a group. Now for any particular issue, there is a tension here. It is a continuum. Is agency or is structure the main determining factor behind behavior? Now to give you an example here, we could take food. An individual decides, I would like to get healthier and I'd like to change, I would like to be more fit and healthy. So they can exercise their agency. They can say, well, I'm going to start running, I'm going to do lift weights in my garage, I'm going to eat more fruit and vegetables. These are individual choices using their agency. However, when it comes to choosing their food, they're still limited by what is available. For example, perhaps they can't afford organic food structure because of their socioeconomic status, their job, their access to money, their access to a car to get them to different places to buy food. Also, we have very little control over the food that is provided in Australian society. For example, farming practices. Do you know what chemicals were used to grow particular foods? Do you know how foods were processed? And so therefore, there's some aspects there's some social constraints within which people have to act within. One example here would be McDonald's. So the structure is that McDonald's has a set menu and it is the same globally. That's why many people like it, because when you go into McDonald's, you know exactly what you were going to get. And you'd get the same in Copenhagen as you would in Caracas, as you get in Vancouver. But agency could be that people say they begin to buy the fresher aspects of McDonald's food, and they begin to critique and criticize McDonald's for the fact that they have very high fat, high salt, high processed food. Now we see the structure of McDonald's menu, their delivery system has changed to now have a healthier menu so that people have more options. So it is seen as a continuum, and it is a debate. To what extent does agency or social structure influence our behavior? Now here's an interesting slide to demonstrate that concept. Number 8 in the toolkit is social sciences methodology. What we do every time, and I've done it in this lecture as well, is to start off by defining key terms. We can't talk about something until we first understand what we mean by it. So as you saw with health, there are different ways to understand health. Before you and I can talk about health effectively, we have to know how each of us understand that key term. Then we talk about the key term and we provide examples. And in this unit, you'll see we draw from statistics, from case studies, from a number of different sources of evidence. Then we link that to outcomes and finally relate that to professional practice. What are the implications of this for a range of health professionals? Now, I'll talk about this again, but I recommend that you follow this format in your essay, in your presentation, in the final exam, when you do the activities, either in tutorial for an on-campus student or online for an external student. So imagining health, the concepts that I've talked about today will be explored throughout the unit. Next week in the lecture Anthropology and Health, we look at the last 2 aspects of the toolkit, culture and the social construction of meaning, and self-reflexive thinking. So in Imagining Health, we're going to look at a range of really interesting case studies, both the global and the local, and we will be exploring the connections between what's happening here in Perth or in Australia with what's happening in other parts of the globe. We're going to look at power, particularly the people who are marginalized from power. We're going to look at social exclusion. We're also looking at natural or human-made disasters. We are using both self-reflexive and critical thinking in this unit, and I'll talk more about self-reflexive thinking next week. The main thing I want you to get from this introductory lecture is that health is indeed a social experience, and health needs to be understood in social and cultural contexts. Thank you for listening.